So there was four organisations that tendered to run these pilot programmes on individualised funding. Because we don't have individualised funding in Ireland, we still don't have it. These four organisations were kind of getting seed funding to set it up and implement it and test it out and see what were the successes and challenges of implementing it in Ireland. I started off by doing a documentary analysis, so that was basically getting all the documents from the four organisations that they thought were important in the implementation. And so that informed my interview guides, basically, for the interviews that I was going to be doing. And they were very much exploratory interviews because there's very little known about individualised funding in Ireland. I basically wanted to see whether individualised funding was realistic within the Irish context, and also to see whether it was effective at improving people's outcomes and creating more self-determined life that's integrated within the community and with more independence and stuff like that. To summarise, is that even without the structures and processes in Ireland to facilitate individualised funding, it's still working. So people in these pilot projects actually left the traditional service providers that they were with, left them completely with no plan to go back. Some people had a plan to go back. They had kind of contingency plan that if it didn't work out that they could go back. But the other people were so frustrated with the traditional model in Ireland that they were just happy to move on. So there was varying degrees of success, but across the board I would say that, yeah, it definitely gave people more independence. It improved a lot of areas of their lives. It increased or improved self-image, so people saw themselves as being more successful, more independent. People saw themselves as being leaders, saw themselves as being innovative and creative and all of these very positive things. Also, people felt that it was very empowering. There was lots of successes, but there was also challenges, and I suppose the challenges, I kind of categorised them under individual challenges, process challenges, and then organisational or system challenges. So in terms of individuals, some of the challenges were identifying activities. So these people are used to being in a service that has a set number of options, and you choose from that whatever you want to do, whether that is sport or art or whatever the case may be. And then there was one really good quote actually that I really like, and it was one of the brokers that was working with the people, or coaches or facilitators, whatever the term is, and he said that he described it as a porridge society, that we've lived in a world where, or oatmeal, where we've offered porridge to people all their lives, and then all of a sudden we give them an a la carte menu and say, what do you want? And they say, I'll have porridge, because that's all they know. And his point was that we need to sit down with these people, we need to help them realise what it is that they want to do and help and support them. In terms of process then, one of the successes there was the whole circle of support. I know it's not new, but it's new in Ireland, I guess, and building up that circle of support. So broadening the family that's involved to siblings, aunts, uncles, whoever the case may be, whatever the case may be, friends, and then building up that concept, because it's very new, and especially in Ireland, we don't like to really interfere, or we need to be asked in and to offer suggestions and stuff like that. So people were quite hesitant to start with, but then once they got the ball rolling, it was very successful, and it really did enable the person to think about what it was that they were interested in and tease it out, and get suggestions from the floor, and talk that out and see how they might actually go about doing that within the community and within current resources that are within the community. The circle of support and natural supports really underpinned the whole process for a lot of people. And where those natural supports weren't in place, then I guess another challenge was building up those natural supports. And that would have taken a lot of time for the staff and for the brokers to identify potential supports that are within the community, and then making those introductions and making sure that the person's happy to bring these people into their lives and that they're actually helping them. There was a bit of organizational resistance, even within these organizations that had said, we want to pilot this new way of doing things. So even when some of the staff members were applying for this particular grant, you had some senior staff members saying, oh, no, I don't think that's the way we're going in Ireland. I don't think that's the way the funders want to fund things, even though our policy is very progressive and it's looking at international best practice and saying, yes, this is the way we're going. But then you have managers in the health service in these different organizations not actually realizing that that's the way things are going. But then obviously the person still went through and they got the funding. During the pilot, there was kind of a disengagement from some of the more senior managers, and they kind of didn't really want to talk about the project in staff meetings and stuff like that. Don't know why exactly, but there was then a sense of the staff that were involved in the project becoming a bit demoralised and demotivated. And then after the pilots were over, you even had staff again saying, oh, you know, this isn't really going to happen for another 5 or 6 years. And you have the staff members saying, no, it's happening now, we're doing it. And they're like, no, it's not going to happen. And so again, kind of potential for staff to become demoralised and stuff like that. So I suppose these are just things that I'm presenting out there and saying that these are things that organisations who are interested in doing this need to be aware of. One of the big things in terms of process and systems and for individuals is decoupling the money from the block grant. So the way services are funded in Ireland is through block grant. So a service provider would get the money and then it's, you know, it's used in kind of congregated settings to provide generally group-based services. And I suppose one of the individual findings that I found was that people really didn't like group-based services and they didn't enjoy them. They much preferred one-on-one mentorship because they were able to adapt whatever based on their needs, whatever that service was. But as it stands, there's no way of actually assessing individuals to see how much money they need. So these organisations who were trying to pilot this were going to disability managers and saying, look, we need to get the money released from the service providers that they were in, and it was tied up for 5 years, so then they'd have to work directly with the service provider who had the money and see if they'd release the money. And some service providers were willing to do that and happy, and others they were resisting, and for genuine reasons, because they're running a service and regardless of whether they're supporting 15 or 16 people, they're still, or 20, they still have the same overheads. When I had gathered my data and I'd analysed it, I pulled together a participatory workshop. So I invited the 4 organisations back, and that involved people with disabilities, family members, advocates and staff members. And I presented my findings to them, and it was really to see if my thematic analysis reflected what they felt were the key themes and key messages that was coming out of it, and it was kind of to validate the findings and also to get their feedback about next steps.